Picture this: you're sitting at the dinner table with your family. Everything feels normal. Suddenly, your father clutches his head in unbearable pain. Within seconds, he collapses, unable to speak, unable to move. Panic sets in. You rush to call for help, but by the time the ambulance arrives, his condition has worsened dramatically. What just happened? It wasn't a heart attack. It wasn't simple fainting. It was something far more devastating, a brain hemorrhage, a medical emergency that can strike anyone, anywhere, without warning. A brain hemorrhage is not just a bad headache or a regular stroke. It is literally bleeding inside the brain, a ticking time bomb where every second counts. Imagine a delicate electrical system short-circuiting because blood, which is supposed to flow safely inside vessels, has leaked into brain tissue. The pressure builds, neurons die, and critical functions, like speech, movement, memory, and even breathing, start to shut down. Here's the frightening part: most people don't recognize the signs until it's too late. They dismiss the warning symptoms as stress, fatigue, or just another migraine. But the truth is, knowing the early red flags can be the difference between life and death. Every year, millions of lives are altered forever by brain hemorrhages. Some survivors are left unable to walk, talk, or live independently. Others don't survive at all. And yet, with quick recognition and immediate treatment, survival rates improve dramatically. That's why today's video is so important. We're going to break down what really happens inside the brain during a hemorrhage, the hidden causes you might not expect, the silent symptoms you must never ignore, and the life-saving treatments doctors use to fight back. So stay with me, because what you're about to learn might just save your life or the life of someone you love. Welcome to today's video. If you're new here, we simplify complex medical topics into clear, easy-to-understand explanations, especially focusing on senior health, where awareness can literally save lives. Today's subject is one of the most serious emergencies in medicine, the brain hemorrhage. You may have heard the term before, sometimes called a bleeding stroke, but very few people truly understand what it means, how it strikes, and why it can be so devastating. A brain hemorrhage happens when a blood vessel inside the brain bursts, spilling blood into areas where it doesn't belong. Unlike a clot-based stroke, where a blockage stops blood flow, this kind of stroke floods and damages brain tissue directly. The result? Sudden headaches, weakness, seizures, confusion, or even collapse without warning. But here's the critical point: not all brain hemorrhages are the same. They can happen in different parts of the brain, and each type behaves differently. Some develop from high blood pressure, some from injuries, others from hidden aneurysms that may have been silently growing for years. In this video, we'll explore exactly what happens inside the brain during a hemorrhage, the key symptoms you must recognize immediately, the hidden causes and risk factors, and the treatments doctors use to fight back. By the end, you'll have the knowledge to protect yourself and your loved ones from one of the deadliest medical conditions. A brain hemorrhage is one of the most dangerous medical emergencies anyone can face. In simple terms, it means bleeding inside the brain. But to understand how serious this is, let's take a closer look. Your brain is like the command center of your body, responsible for movement, memory, speech, emotions, and every automatic function that keeps you alive. It's soft, delicate, and protected by the hard shell of your skull. Inside, billions of nerve cells communicate through electrical signals, powered by a constant supply of blood carrying oxygen and nutrients. Now imagine one of the blood vessels inside this system suddenly ruptures. Blood begins leaking where it doesn't belong, into the brain tissue. The problem is, your skull is a closed, rigid box. It cannot expand. So as blood pools, it builds pressure. This pressure compresses brain tissue, restricts oxygen supply, and begins killing nerve cells within minutes. Doctors classify a brain hemorrhage as a type of hemorrhagic stroke, which is different from an ischemic stroke caused by a blood clot. In fact, hemorrhages account for about 10 to 15% of all strokes, but they are usually more deadly and more likely to cause long-term disability. There are several types. Intracerebral hemorrhage, bleeding directly into brain tissue, the most common and severe form. Subarachnoid hemorrhage, bleeding into the space between the brain and the thin tissues covering it, often caused by a ruptured aneurysm. Subdural hemorrhage, bleeding between the surface of the brain and its outer covering, often after trauma or falls. Epidural hemorrhage, bleeding between the skull and the brain's protective covering, usually from head injury. No matter the type, the danger remains the same: increased intracranial pressure, brain swelling, and destruction of vital brain cells. In severe cases, the brain can even shift position inside the skull, a phenomenon called herniation, which can be fatal. The harsh reality is that once brain cells die, they do not regenerate. That's why early recognition and emergency treatment are critical. A brain hemorrhage isn't just a medical term, it's a fight against time, where every second determines how much of the brain, and how much of the person, can be saved. A brain hemorrhage can appear suddenly, and its symptoms often strike without warning. What makes it so dangerous is that many of the early signs are mistaken for something less serious, like stress, migraine, or fatigue. But when it comes to bleeding inside the brain, every second counts, and recognizing the red flags can mean the difference between survival and tragedy. One of the most common and frightening symptoms is a sudden, severe headache. Patients often describe it as the worst headache of their life, explosive in intensity and unlike anything they have felt before. This is particularly true in cases where bleeding occurs in the space around the brain, known as a subarachnoid hemorrhage. Along with this intense pain, nausea and vomiting frequently follow. This is not the usual nausea after eating something bad, it is the brain itself reacting to the increased pressure caused by trapped blood inside the skull. Another telltale sign is sudden weakness or numbness, often affecting just one side of the body. For instance, if bleeding occurs in the right hemisphere of the brain, it may cause weakness or even paralysis on the left side of the body. Speech can also be affected. Some people may slur their words, struggle to find the right expressions, or fail to understand what others are saying, especially if the bleeding strikes areas responsible for language. Vision problems are also common, ranging from blurred or double vision to sudden blindness in one eye. In some cases, the bleeding irritates brain tissue so much that it triggers seizures, even in people with no history of epilepsy. If bleeding affects the brain's balance centers, such as the cerebellum, a person may suddenly lose coordination, stagger, or collapse. There are also changes in behavior and consciousness. A once alert individual may become drowsy, confused, or unable to recognize familiar people and places. Loved ones may notice they don't seem like themselves. In severe cases, the person can lose consciousness altogether and slip into a coma, which is often a sign of massive bleeding or pressure on the brainstem. Not all hemorrhages look the same. A small bleed in a non-critical area may cause only a severe headache, while a larger bleed near vital centers can cause immediate collapse. Early signs like headache, dizziness, weakness, or confusion are often dismissed, but they should never be ignored. Later signs, such as seizures, coma, or breathing problems, signal life-threatening progression. The bottom line is simple: never wait to see if symptoms improve on their own. If someone experiences sudden headache, weakness, speech difficulty, or vision loss, call emergency services immediately. Every second lost means more brain cells lost, and once they die, they cannot be replaced. Time is the most critical factor in saving both life and function in a brain hemorrhage. When we ask what actually causes a brain hemorrhage, the answer is not just one thing. It's often the result of years of hidden strain on blood vessels or a sudden event that ruptures them without warning. The most common underlying cause is high blood pressure. Over time, uncontrolled hypertension weakens the walls of arteries in the brain, making them fragile and more likely to burst. Many people live with high blood pressure without symptoms, unaware that every day their vessels are slowly becoming more vulnerable to rupture. Head trauma is another major cause, particularly in older adults. A simple fall, a car accident, or even a blow to the head can tear fragile veins or arteries inside the skull. This kind of injury often leads to subdural or epidural hemorrhage, where blood collects between the brain and its protective layers. Seniors are especially at risk because with age, the brain shrinks slightly, stretching blood vessels and making them more prone to tearing during impact. Aneurysms are another silent danger. These balloon-like bulges in the walls of arteries can sit quietly for years, unnoticed, until one day they rupture. When that happens, the bleeding is often catastrophic, flooding the spaces around the brain and creating sudden, severe symptoms. Similarly, arteriovenous malformations, or AVMs, which are tangled clusters of abnormal blood vessels, can rupture unexpectedly and lead to hemorrhage even in younger people. There are also conditions that affect the blood's ability to clot. Disorders like hemophilia, very low platelet counts, or advanced liver disease increase the risk of uncontrolled bleeding. Certain medications, especially blood thinners such as warfarin, aspirin, or clopidogrel, make the vessels more likely to bleed. While these drugs are life-saving for many conditions, they also carry this hidden risk if not carefully monitored. Lifestyle factors can add to the danger. Heavy alcohol use weakens blood vessels and raises blood pressure. Illicit drugs like cocaine or amphetamines can cause a sudden spike in blood pressure, leading to vessel rupture even in young adults with otherwise healthy arteries. Brain tumors, though less common, can sometimes bleed internally, mimicking or triggering a hemorrhage. Age itself is a major risk factor. After 60, the likelihood of brain hemorrhage rises significantly because blood vessels naturally lose elasticity and the protective mechanisms of the brain become weaker. Family history also matters. If close relatives have suffered from aneurysms, strokes, or brain bleeds, the risk increases. Sometimes, it's not one single cause but a combination. A person with untreated high blood pressure, who also drinks heavily or takes blood-thinning medication, lives under constant risk without even realizing it. Even daily habits like lifting very heavy weights or experiencing extreme emotional stress can trigger a sudden spike in pressure that pushes a weakened vessel over the edge. The key to prevention is awareness. By controlling blood pressure, limiting alcohol, avoiding drugs, and getting regular medical checkups, especially if you have risk factors, you can drastically lower the chance of this silent and deadly event. When someone suddenly collapses with symptoms of a brain hemorrhage, doctors know that every minute matters. The first step in the hospital is stabilizing the patient, making sure they can breathe properly, that the heart is working, and that blood pressure is under control. But at the same time, doctors must confirm whether the problem is truly a brain hemorrhage and, if so, where exactly the bleeding is taking place. The fastest and most reliable test is a CT scan. This imaging test can show bleeding in the brain within minutes and is usually the first choice in emergencies. A CT scan not only confirms that bleeding is present but also reveals its size and location, which is crucial for deciding treatment. Sometimes, if more detail is needed, especially in smaller bleeds or unusual cases, doctors use MRI scans. These provide a clearer picture of brain tissue and can help detect subtle changes that a CT might miss. If doctors suspect the bleeding is caused by an aneurysm or an abnormal cluster of blood vessels, they may perform cerebral angiography. This involves injecting dye into the blood vessels of the brain and taking detailed images to see if there are any weak spots or malformations. Blood tests are also performed to measure clotting ability, platelet count, and other vital indicators that influence treatment decisions. The purpose of diagnosis is not only to confirm bleeding but also to identify the underlying cause, because treatment depends on whether it was triggered by high blood pressure, trauma, an aneurysm, or blood-thinning medications. Quick, accurate diagnosis is the key to saving brain tissue and giving patients the best chance at recovery. When doctors confirm that a patient is suffering from a brain hemorrhage, the next step is urgent treatment. The first priority is always to stabilize the person's vital functions, making sure the airway is clear, the patient is breathing properly, and circulation is supported. In many cases, patients arrive in critical condition, so emergency teams work quickly to prevent further damage while preparing for targeted treatment. One of the most important steps in the early stages is controlling blood pressure. If it is too high, the bleeding can worsen, but lowering it too quickly can also deprive the brain of blood flow. Doctors use carefully chosen medications through intravenous lines to bring the pressure down gradually and safely. At the same time, if the patient is taking blood thinners such as warfarin or antiplatelet drugs like aspirin, doctors must reverse their effects. This can be done by giving special medications, vitamin K, or platelet transfusions to restore the blood's ability to clot. To reduce brain swelling, doctors may prescribe diuretics that remove fluid from the body or steroids that decrease inflammation. These steps help relieve the dangerous pressure that builds up inside the skull when blood has leaked into the brain tissue. Anti-seizure medications are often given as well, because seizures are common after a hemorrhage and can further harm the brain if uncontrolled. In many cases, however, medication alone is not enough, and surgery becomes necessary. One common procedure is a craniotomy, where a part of the skull is temporarily removed so the surgeon can directly access the brain, remove the pooled blood, and stop the source of bleeding. This procedure also relieves pressure and allows the brain to function more freely. For certain patients, minimally invasive approaches are used. These involve inserting a thin catheter through a small opening and draining the blood with much less disruption to surrounding tissue. When the cause is a ruptured aneurysm, surgeons may either clip the aneurysm at its base using a tiny metal clip or perform a coiling procedure, where soft platinum coils are inserted through a catheter to fill the aneurysm and prevent it from bleeding again. Both techniques aim to stop further rupture and protect the patient from another catastrophic bleed. In some cases, when the brain is swelling rapidly and dangerously, doctors perform a decompressive craniectomy. This involves removing part of the skull for a longer period of time, giving the swollen brain room to expand safely without being fatally compressed. Treatment does not end once the bleeding has been stopped. The road to recovery is often long and requires rehabilitation. Many survivors of brain hemorrhage are left with weakness, speech problems, or difficulty performing everyday activities. Physical therapy helps rebuild muscle strength and coordination, while occupational therapy retrains patients to manage daily tasks like dressing, eating, and walking independently. Speech therapy is vital for those who struggle with communication after their stroke. Emotional and psychological support is also essential, as many patients experience frustration, depression, or anxiety during recovery. The overall outlook, or prognosis, depends heavily on how large the bleed was, where it occurred, and how quickly treatment began. Small bleeds in accessible areas can sometimes be managed effectively, allowing patients to return to near-normal lives. Larger bleeds deep in the brain, however, carry a higher risk of permanent disability or even death. Despite this, early recognition and rapid medical attention can dramatically improve survival and recovery. In the end, treatment for brain hemorrhage is a race against time. Every minute matters, every decision counts, and the combination of immediate emergency care, targeted surgery, and long-term rehabilitation gives patients the best chance at not only surviving but also regaining independence and quality of life. While modern medicine offers powerful tools to treat brain hemorrhage, the truth is that prevention is far more effective than any emergency intervention. Many of the risk factors that lead to a hemorrhage are manageable, and small lifestyle changes can dramatically reduce the chances of ever facing this terrifying condition. The most important step is controlling blood pressure. Hypertension is the #1 cause of brain hemorrhage, yet it often goes unnoticed because it produces no symptoms until damage is already done. Regularly checking blood pressure at home or during doctor visits, taking prescribed medications, and reducing salt intake can all help keep it under control. Avoiding smoking and limiting alcohol are equally vital. Cigarette smoke damages blood vessels, making them brittle, while heavy drinking raises blood pressure and weakens arteries over time. Choosing moderation in both areas protects vascular health and reduces overall stroke risk. Regular exercise also plays a crucial role. Something as simple as walking for 30 minutes a day strengthens the heart, improves circulation, and keeps blood vessels more resilient. Pairing this with a diet rich in vegetables, fruits, whole grains, and healthy fats like omega-3s from fish supports the brain and the cardiovascular system. Medication management is another key factor. Blood thinners are life-saving for many heart conditions, but they must always be taken under medical supervision. Patients should never adjust or stop these drugs on their own, as both overdosing and neglecting them can be dangerous. Finally, preventing head injuries is especially important for seniors. Installing grab bars in bathrooms, using supportive footwear, ensuring good lighting at home, and being cautious with balance can prevent falls that lead to traumatic brain bleeds. Taking these steps may not completely eliminate the risk, but they greatly reduce the chances of brain hemorrhage, protecting both brain health and independence as we age. We've now reached the end of this journey into one of the most serious and life-changing medical emergencies, the brain hemorrhage. By now, you understand that this is not just another type of stroke, but a dangerous event where blood leaks into the brain tissue, disrupting delicate connections and putting life itself at risk. It is fast, it is silent, and it often arrives without warning. Yet, knowledge is the most powerful shield we can have against it. We have seen how brain hemorrhages occur, the different ways they affect the brain, and the variety of symptoms they produce, from sudden headaches and weakness to confusion, seizures, or even unconsciousness. We also explored how doctors race against time, using CT scans, MRIs, and angiography to diagnose the problem within minutes. Then comes the critical stage of treatment, controlling blood pressure, reversing blood thinners, managing swelling, and when necessary, turning to life-saving surgeries such as craniotomy, coiling, or clipping of aneurysms. Recovery may be long and challenging, but with rehabilitation and persistence, many people do regain strength, independence, and dignity. What stands out most is the fact that prevention is always more powerful than cure. High blood pressure, smoking, alcohol misuse, head trauma, and poor lifestyle habits are all risk factors we can influence. Simple, consistent actions like eating healthily, exercising regularly, managing medications wisely, and avoiding unnecessary risks can protect the brain far better than any emergency surgery ever could. If there's one takeaway from today's video, it's this: never ignore warning signs. If you or a loved one experience sudden severe headaches, vision problems, weakness, or difficulty speaking, treat it as an emergency. Call for help immediately. Minutes lost can mean brain cells lost, and that can mean the difference between life, disability, or death. So, as we close, I invite you to take this knowledge seriously. Share it with your family and friends, because awareness saves lives. Protecting the brain means protecting everything that makes us who we are, our memories, our relationships, and our independence. If you found this video valuable, don't forget to like, share, and subscribe. More senior health insights are coming your way, each designed to help you stay informed, safe, and strong. Until next time, take care of your health, take care of your brain, and remember, prevention is always the best medicine.